Hello everyone. I would like to warmly welcome you, all of you behind the screens, in our large animal clinic and in our large animal department, as well as Veterinary Research Center and Biomedical Research Center. This is the theater which is used by all of these units. So today I would like to introduce you with basic techniques of the local anesthesia, of the infusion anesthesia and inhalational anesthesia, which we use here in these operation theaters. I would like to really so much thank you for this possibility to meet today with you guys because of our lovely team who is now behind the cameras. This is the filming crew, very professional filming crew from our faculty, which of course allows us to meet today. Okay, first of all, I would like to start about general anesthesia term explanation. What is that? This is the process which we so much need for our patient, independently if it is animal in our private clinic, in our operation theater, in our cabinet, or maybe it is animal used for clinical research, transitional research, and any kind of research and development techniques. All of them are our beloved patients, and as a vet, we have to take care about them as much as we can. We need to think about this, how to reduce the stress, the discomfort, and the trauma which they have each time after meeting with us as a vet, because they're afraid of us so much. That is why we can use many different drugs, many techniques of sedation, premedication, infusion anesthesia, general anesthesia, to proceed all needed operations as well as the diagnostic processes. First of all, I would like to show you and I would like to present you basic techniques and basic drugs which we use during general anesthesia. Let's start from local anesthesia and from regional techniques. You know these techniques and this type of anesthesia the best from your own experience, because I'm sure that during your dental procedure and stomatologic treatment, you were treated with these techniques, with these drugs. The same drugs, the same techniques we use in our patients. So, our local anesthetic we give with multiple injections along our cut line, or we can give this anesthetic to the epidural space using special sets, special dedicated commercially available sets for it. And we'll obtain the anesthesia, so painless region of part of the body or the organ. Do you think is it pleasant procedure for our patient? Because we as a human beings, we are so patient. We won't escape, we won't kick, and we won't bite. For example, if the doctor will do such a things for us, but our patients really afraid of us so much. So that is why usually we do local anesthesia after sedation or premedication in our patients, which we need drugs. The most popular drugs used for sedation, so it means to calm down the patient, to ease a little bit agitation and anxiety. In veterinary medicine, it is the whole group called alpha-2 agonists. We have different drugs dedicated for different animal species. They are sensitive for different isomers of the drugs from the same group. And these drugs, usually, we give subcutaneously or intramuscles. Then we are able to proceed our local techniques. The one and only species which is really imagined for local anesthesia, for local blocks, is cattle. Our beloved cows really maintain these techniques so well after physical restraint, and also really the smallest amounts of drugs from the alpha-2 agonist group. Then we are able to proceed the left flank anesthesia or epidural anesthesia. After the local techniques, another type of anesthesia is infusion anesthesia. What does it mean? It means that all of the drugs which we know, we are administered intravenously. After IV catheterization, we will maintain our anesthesia and induce our anesthesia using the drugs which we give intramuscle or intravenously. Another type of anesthesia is inhalational one. For inhalational anesthesia, after endotracheal intubation, we will use this machine. This machine is dedicated for general anesthesia, for inhalational anesthesia as we call it. It's equipped in 2 vaporizers, which in magical way inside converts the fluid which we buy in our veterinary chemists. The 2 most popular ones now are isofluran and sevofluran. They are widely used in veterinary medicine currently. So both of these fluids goes inside to the vaporizers and then evaporates inside, converts into gas fumes, and this machine, equipped in flow meters and of course in the artificial ventilator, gives this gas into airway system of our patients, allows for sleeping, it means anesthesia, for a very long time in a very safe way. Because guys, look, this type of anesthesia, which we use drugs, any kind of drugs, is really difficult to control because everything depends on our clinical status, health status, and all of concomitant disease which influence on the metabolism of our patient, as means all of these drugs which we use. This type of anesthesia is very easy to control. It allows us easily to awake animal and to put asleep an animal for the time which we wanted and for the time which our surgeon wants. All of the techniques which we have here, so local techniques, infusion techniques, and inhalational one, when we combine all of them, we call this balanced anesthesia. This is the type which is currently used worldwide, everywhere, anytime. Because if we are able to reduce side effects of each technique, then after balance all of the benefits from each of them, we are able to proceed our patients for any kind of procedure, any length of the procedure, without any trauma and distress of our patient. Now, if we want to know how our patient sleeps and what is going on with our patient during any kind of procedure, we use monitoring device. This is the basic monitoring device used during surgeries and during diagnostic procedures. I will show you now what kind of info it gives us. First info, of course, it gives our heart rate and the quality of the heart rate, because it shows us EKG, which tell us about the electricity of the heart muscle. Also, it gives a lot of info about now, currently, very famous parameter, which we called spirometry. So it means how much oxygen is inside the blood of our patient. That is why we use special endings for each species of the animals. But the rule of the thumb, look, it started to show the curve, but the result, it's not so, oh, now it's perfect. But it's not, it must be reliable. So, rule of the thumb, do not use nail polish. I'm kidding. Remember, please, that this end tip needs to be placed on a skin or on the mucus without any pigmentation, because any kind of discolorization on the surface gives you not reliable data. Also, this equipment is able to tell us something about the intra-arterial pressure and intravenous pressure, also the level of body temperature and non-invasive pressure, non-invasive arterial pressure. The another screen which you see here, it gives you the control about the whole system of ventilator, artificial ventilator, which is widely used during the surgery to control the breathing rate of our patient. And as I mentioned before, all of the techniques and all of these drugs gives us the opportunity to safely proceed any kind of procedure which you need to do during your practice, veterinary practice or researcher practice.